why we need to focus on the surgery, and what are the benefits that Aster offers, and anything else that you want to share with the audience.
Hi, my name is Dr Safiya Masrouri. I'm a minimally invasive and bariatric surgeon. So obesity is a disease, okay? So obesity happens because of excess of adipose tissues, which are essentially excess of fat cells within the body. And there are several definitions or several measurements that we use to define obesity. The most common that we use usually is the body mass index, which is basically the weight divided by the height squared. Usually for a person to qualify for a bariatric surgery, the BMI is usually either above 40, or if a person has a BMI above 40 with any obesity-related medical condition, that could be osteoarthritis, or sometimes fatty liver, or diabetes, or high blood pressure, or anything that could could be related to obesity itself. It's an endemic, it's a major healthcare problem, and definitely has a lot of consequences on the person's quality of life. It does definitely predispose the person to several medical conditions, and it has been associated to decreased life expectancy. So it's a major health problem, not only here in Oman, but also worldwide. Yeah. It's actually, the figures of obesity are actually alarming. If we were to look at the figures here in Oman, there are at least like 1 out of 4 are either overweight or obese within the Omani population. And what's more alarming is that we're seeing more figures of obesity amongst kids too, especially amongst female kids. So in the past, like let's say if we were to look at the 70s, most of the kids were actually underweight or they're malnourished. But then we're now looking at alarming figures where at least it's a good percentage of kids are actually suffering from overweight and obesity at a very young age. And that actually predisposes them to major health concerns when they become adults and even when they grow up in age. So definitely requires a lot of attention, and it's something that we should not really overlook.
Is it genetic, hereditary?
So it's obesity. People used to think that obese people are obese because they overeat or they don't move, which is really a misunderstanding of obesity. Obesity is a complex medical condition. If it was due to overeating or just not moving, it would have been a simple medical condition. But unfortunately, this is a complex medical condition. It's very multifactorial. A lot of factors come to play, which includes hormonal, genetic predisposition, familial predisposition. Sometimes could be related to the medications that the person consumes. Besides the lifestyle, you know, but it's not just a simple, you know, it's like a simple equation where just a person, if the person overeats or doesn't move, becomes obese. If it was that, it would have been a way easier problem to deal with.
Doctor, from your personal experience, I want to ask you, especially in Oman, do you see more men coming for such treatments and surgeries, or do you see women?
Majority of our patients are actually women, okay? So I'd say about 75% of our patients population who seek bariatric surgery are mostly women. And that also mirrors the statistics because we see the rates of obesity higher amongst women compared to men. And again, this could be due to multiple factors. Obviously, women going through different phases in life, going through pregnancies and the weight gain with the pregnancies. A lot of women would usually struggle to lose the post-pregnancy weight. Again, also postmenopausal, we see a lot of hormonal changes amongst women, so that kind of a bit slows down the metabolism and makes weight loss a bit of a challenging issue amongst women compared to men. Maybe talking about the society here, some of the women have less active lifestyle compared to men, which is a little bit changing now, I would say, in the society. You could see a lot of women engaged in a lot of physical activities, participating in a lot of physical activities, and there's more awareness when it comes to maintaining a healthy lifestyle nowadays. But overall, definitely, it's more like the figures of obesity are more amongst women compared to men, and that also reflects on the patient population seeking for surgery too. Yeah.
And does stress anywhere at all play a role in any of this?
I mean, yes, I guess. Definitely. I mean, it's like, yeah, everything is, as I said, like it's a multifactorial issue, like, you know, condition. So a lot of psychological factors also come to play in terms of obesity and also the management of obesity. You can imagine the amount of psychological stress, and then sometimes, especially amongst younger patients, a lot of stigma that comes with obesity, and a lot of people would sometimes even hesitate to seek for treatment. You see a lot of kids being bullied in school, a lot of teenagers avoiding even talking about the condition, just not for them not to be, you know, it's like stigmatized in the society, which sometimes delays people from seeking care, you know, when it comes to obesity.
And I hope this opens up doors to a lot of people to actually at least come to get free consultations.
Absolutely,
and speak to, you know, all of you, and have that, you know, confidence that, you know, I mean, their body can change, and they can also go towards healthy lifestyle and feel good. And so let's hope for the best.
We're more than happy to help you to make the right decision for yourself, basically for you to be able to achieve the desired results. We're here to help you. Remember, you're not alone in this, so definitely it does help to speak to specialists when it comes to obesity.